Hello, I'm Dr Louise Newson. I'm a GP and menopause specialist, and I'm also the founder of the Newson Health Menopause and Wellbeing Centre here in Stratford-upon-Avon. I'm also the founder of the free Balance app. Each week on my podcast, join me and my special guests where we discuss all things perimenopause and menopause. We talk about the latest research, bust myths on menopause symptoms and treatments, and often share moving and always inspirational personal stories. This podcast is brought to you by the Newson Health Group, which has clinics across the UK dedicated to providing individualised perimenopause and menopause care for all women. Today on my podcast, I've got another guest from the other side of the world. So in Melbourne, Australia, I've got with me Professor Szoeke, who is Director of Women's Healthy Aging Project. And she is also an author. She's very active academic and incredibly clever. So I feel very honoured that she's agreed to join me on the podcast today, even though it's very late at night for her. So thanks ever so much, Cassandra, for coming today.
My pleasure.
So I don't know whether you know, but some of my listeners know that I've got a pathology degree as well. And I spent a good 9 months with a professor of biochemistry, actually. Sadly, he's died now. I wish I could go back in time and ask him even more questions, because he spent a lot of time talking about monocytes and macrophages, which are types of white cells. I'm talking about how important they are to fight infection. But when they go wrong, they can become pro-inflammatory, so increase inflammation. And there are various circumstances in our environment that make our body become more against us, really, and increase inflammation. And I was sitting there thinking, oh, what's this got to do with helping people with heart attacks? Or what's this going to help people with cancer? Because I wanted to do cancer medicine. And then by the end of the whole course was a year, the BSc, but after 9 months, it suddenly clicked. And I thought, actually, this is all related. This is like the relationship of heart disease and cancer is there, like dementia and osteoporosis is there. But no one had taught me this ever before. And that was in 1992. And lots of people still don't understand. And so there is so much that is really relevant and even more relevant to the work that I'm doing now with hormones. So before we get into all the science, I'm just keen to hear a bit about your background and how you got to where you are now and what fueled your interest.
Well, in Australia, we have a very similar system of medical training to the UK. And so that means we do general training as general physicians before we specialise in a subspecialty area of internal medicine. So I became a physician first, which is a very long program. And then after that, did my training as a consultant neurologist. And then I did an epilepsy fellowship because, of course, you have to know everything about one little molecule nowadays. But yes. I am a generalist in my heart and in my being. And so when I was moving into academia, I got really interested in healthy aging because the area I actually looked at, would you believe, after doing an epilepsy fellowship was epilepsy and cognition. I, of course, had many of the younger patients as a young consultant neurologist, and they were on anticonvulsant medications, and they were all at uni because I work at the hospital that's associated with the university, and they were telling me that on these medications, they just couldn't think as well anymore. So I got really into cognition, and when you start looking at these diseases, if I could say this, the diseases we used to associate with aging, thought of as aging diseases, I suddenly realised that it was this whole encapsulated inflammatory cascade. So all the chronic diseases of aging have an inflammatory component to them.
Which is so relevant. And certainly, I, as you might know, I trained as a physician as well, so had a long training before going into general practice. And no one really talked about aging or what it meant. And even now, I don't think so, because you just Google aging and it's always anti-aging face creams, isn't it? And it's trying to keep us young rather than prevent aging. And that's quite different, I think.
Well, I think there's so many funny things about the word aging and how it's perceived in Western culture, perceived much better in Eastern culture, actually. But I also think we forget that aging was 27 in the 1900s, you know, and, 1960s aging was 50. And it's only in the last 2 decades the mean age has been over 80. age of death. And so our perception of aging is entirely different. And I know you're interested in asking about hormones and aging today. And I mean, just looking at what I just said, when the mean age of menopause is 50 and the mean age of death is 50, then you're not getting many postmenopausal women to be able to do any research or do any study or have any knowledge about what is postmenopause for women. And yet today, in your country and mine, where women's mean age is over 80, we're living a third of our lives in postmenopause. So this is an incredibly important part of our lives that we know so little about.
It's so relevant, isn't it? And I think somebody recently, actually, at a meeting I went to, said, "Oh, it's interesting, isn't it? Because orca whales are the other mammal that has menopause, and it's all about nurturing, and it's about you being there for your grandchildren and your wisdom and knowledge as menopausal women." And I said, "I think you've missed the point. Actually, that's part of." Aging is great because when you're older, you have got more wisdom, more knowledge, you can nurture hopefully better, you've got lots of life skills. But that's not the same as being menopausal without hormones. And, we can't be tortured more than we are already by being not allowed our hormones that do more than just stop a few hot flushes or severe hot flushes for some women. But it's more than that. And I think for many years they've been, because they're referred to as sex hormones, but they're not about sex and they're not about gender, actually. They are biologically active chemicals in our body that men and women have them. Everybody has them in different quantities and amounts. But like you say, it wasn't so relevant even 100 years ago because we didn't live so long without our hormones. And the women that did, we only need to look at the number of women locked up in asylums and mental health that was misdiagnosed perhaps when it could have been related to menopause. But now we look at the huge burden of disease because people are living longer. And sometimes it's not, I'm not blaming everything on not having hormones, but it's definitely a contributory factor.
And one of the things about the study which I lead here in Australia, it's the longest running study of women's health in Australia. And what makes it really remarkable is that we have those, it was a study looking from pre to post menopause. That's how it was originally designed. And so it's got all the estrogen, FSH, LSH, all the measures, menstrual diaries, hormone therapy, all of that. However, it was run by a consortia led by a psychiatrist, so all the mental health measures, and a consortia of physicians. So bone measures, as well as the hot flushes and all of that, and then also cognitive measures. And we have amyloid scans of these women's brains. And, that sort of study is really rare, actually. So you'll get the menopausal studies that kind of stopped after menopause, having defined that transitional period. And so it's actually really rare. I mean, I guess it's rare to get any study funded more than 3 to 5 years, let alone the fact for aging, these chronic diseases of aging. So I'm talking about osteoporosis, osteoarthritis, heart disease, diabetes, dementia. These take 3 decades to develop. So if you're not doing a study for 3 decades, you can't possibly see what's actually going on. You're taking snapshots here and there.
Yeah. So what's been the biggest things or the most interesting areas that you've found with your research so far?
Oh my gosh. I mean, our study's got hundreds of publications because it was going for a decade before I joined as a little PhD student. And I personally have more than 200 publications. So that's a huge question. It's such a huge question. But, I will, if there's a sound bite I can give, it would be this. And it sounds trite, but it isn't. If there's one thing you go out and do for healthy aging, whether it be brain, heart, bone, inflammation, mental health, the one thing you can do that's best in all of these metrics, in all the different papers we've done, it's physical activity. It's the one thing you can do that is actually the best for healthy aging.
That's so interesting, isn't it? And I was at an event last night and we were talking about how to make the best of your menopause and make it as healthy as possible. And just as we get older, whether we're men or women. And it's something that I don't think I was taught enough about as a medic. We talked a bit, or we learned a bit about osteosarcopenia, this loss of muscle and bone mass that occurs, but not the importance of exercise and regular exercise as well, which is so important, isn't it?
Yep. Again, I think, we have to look at the fact that, we've increased our mean age of death dramatically, exponentially over the last 2 decades. And so we're still playing catch up with what happens when we don't die of a heart attack at 50 or of an infectious disease at 30.
Yeah. Really really interesting and relevant. And obviously nutrition is a key part as well, isn't it?
Well, talking about inflammation today with you, the gut is a key role player in inflammation, it turns out, which is something that wasn't known a couple of decades ago. But now we're seeing there's a gut-brain axis, there's a gut-everything axis, and it's because of inflammation. So that gut, that good microbiome, that's actually having anti-inflammatory actions throughout the body. In addition to, of course, we need key nutrients and micronutrients that with the oversupply of food now, we can all get calories, but micronutrients are really important. In the old days, when we had to forage for food, we were actually getting quite a few micronutrients in all of that veg that was predominant in our diets.
I mean, certainly people's nutrition has really changed even over the last few decades. But we see a lot of women, and I speak to a lot of women who have symptoms related to irritable bowel syndrome. So bloating, some heartburn, maybe some constipation, just those symptoms where in the past we would have diagnosed irritable bowel and given all sorts of treatments actually often really do improve with hormones. And even testosterone can have a massively beneficial effect on people with heartburn and other bowel symptoms. But I do wonder how much is a direct effect of the hormones and how much is an indirect effect because the hormones are affecting the gut microbes. So it's just a really interesting sort of relationship, I think, that hasn't been explored enough, that I've read. But I think it's something
I
that is so
completely agree.
important.
We need to do a lot more work in that space. Not just that, but the mental health. So, of course, the gut is highly reactive to anxiety. Everyone knows that because everyone gets butterflies in their stomach before they go on stage. So the gut is highly reactive to our mental health status. And of course, there's a lot of evidence, especially in hormone responsive mental health, which is a new field that's developed where people have gone through menopause and they're resistant to some of the antidepressant medications, and when put on hormones, actually improve. So it's very interesting. We never knew there was hormone responsive mental health.
And it is absolutely key. We see a lot of women who are in quite crisis actually mentally when they come and see us, and they've often been seen by mental health teams and been given different psychiatric medication, some of it quite heavy duty, and no one's thought about the hormones. And I didn't realize, even when I did psychiatry as a junior doctor, because no one had taught me. And now with these women, we often give them hormones for their other physical symptoms, knowing that they're menopausal or perimenopausal. But the first time I did it, I didn't really think that it would improve their mental health as much as it does. Certainly having the right dose of hormones, but also testosterone as well, has a massively, in my clinical experience, beneficial effect on mental health, which was something that has not really been explored much at all. It makes sense when we know the role of testosterone throughout our brains, but I'm not really sure why it's been neglected so much when we know that our hormones are made in our brains and work as neurotransmitters, yet it's sort of been all about periods and fertility when we think about not having our hormones.
I think there's a labeling issue with women's health. So I think often when they say women's health, people go, oh, right, tell me about boobs and bits. And so, as a
Yes.
neurologist, I can tell you, when I'm at a women's health conference and somebody comes in late to the seminar and they slip in the back and they look up at the screen and they see a brain scan, they think they're in the wrong seminar. Whereas, to me, the leading cause of death in your country and mine, in women, leading cause of death is dementia. So how we cannot understand that women are brains So I do think a lot of
Yes.
women's health has been done by obs and gynae, and they're probably not so focused on the brain. But, as generalists, anything that crosses that blood-brain barrier, because not everything does. That's why we call it a barrier. Not everything crosses that blood-brain barrier, and
Yes.
estrogen certainly does and has enormous impact on neural cells. So
Yeah, and I think that's really interesting. I was at a event and it was about translational research, and which was great. It was a real honour to be invited. And they said, "Oh, Louise, we've put you on this table number, whatever, and it's with other women's health researchers." I said, "But I'm interested in health of women, not so much women's health." And they sort of looked really, and of course, I'm interested in endometriosis and fibroids and period problems, but I'm more interested actually in cardiovascular disease and metabolic syndrome and dementia. And it's that change. I think being a woman who's interested in health of women, you immediately people think it's gynae problems or maybe, like you say, breast problems, but it's not.
I really like the way you say that, health of women. Maybe that's what we should be rebadging it as, because that's the bit that hasn't been done really
I
well.
think so.
You just look at the amazing investment that's been done. In my country, we have an endometriosis action plan. We have a national plan for PCOS. Breast cancer survival rates have been going up every year, which is incredible. So when you focus on things, you can really improve health. So maybe you're right. We need a rebranding.
I'm pleased you agree. I totally think it's so important when we look at, like you say, the diseases that are causing mortality, but also morbidity as well. The longer we
Mm.
live, the more likely we are to have diseases. And they are the diseases that are affecting us day to day. So it's not so much, of course, it is the age we die, but it's our journey to that age. And it's how many times are we going to be admitted in our 70s and 80s to hospital? How is our cognitive state going to impair us? What about our physical state? Am I going to be dependent on a carer in my 80s? I absolutely don't want to be. I want to keep strong and physically and mentally healthy. And that's what's draining our healthcare system, and I'm sure yours as well, is people who have diseases associated with aging, but then there are other people that have accelerated aging and more inflammation, which is compounded by not exercising adequately, not eating the right foods, not having the right hormones, and also looking at stress, looking at our gut microbe. There's everything together. And I think so much in medicine, we can't be siloed. You as a neurologist stopping your work at the blood-brain barrier would be completely wrong. But there are a lot of neurologists that don't look at the body.
Look, I think you're so right. Often when we say healthy aging, people say, what does that mean? Because they're so caught up in the word aging. And I think, aging is something that's a chronological measure of how many years we've been on Earth. And that, doesn't harm you. So there's many people who die at 99 still carrying some, logs up mountains in those, so-called blue zones, where you can find people who are living very functionally and well into their 90s. So it's not the age that's the issue. We forget sometimes that age is also a measure of how many years we've been smoking, how many years we've had high blood sugars, high blood pressure, high stress, as you mentioned. I mean, the stress issue isn't trivial. I know when we say stress, people might think we're talking about being stressed out, but people who are lonely, who say that they're lonely, we can actually measure that their immune system's depressed. They're more likely to get infections. We can actually physiologically measure the damage to the body from people feeling lonely. So, this idea of stress, I think we're just scratching the surface of what that means for our long-term health.
Absolutely. And there are certain things that will increase the amount of stress that we have. So if we don't sleep, for example, that's going to increase stress, which is also going to have metabolic changes in our body. And I feel a lot of times, especially as a physician in the past, I've been just putting sticking tape on things. And I was reflecting recently about the medications that I prescribe now as a physician. And they're very, very few. And it's not because I've forgotten how to prescribe, but actually people I see don't need as many medications. Whereas in the past, I was prescribing a lot of statins, a lot of blood pressure lowering medication, a lot of painkillers, a lot of antidepressants actually for people, because I was seeing things in isolation and I was very reactive in what I was doing, because I was, treating a raised blood pressure or treating a raised cholesterol. Rather than what I do now is taking a step back and thinking, well, why have they got raised blood pressure? And why have they got raised cholesterol? And what is their nutrition like? What's their exercise like? What's their hormonal status like? And yes, they might need short term some medication to lower their blood pressure, to allow for their exercise, their nutrition, their hormones to be rebalanced properly. But I don't start medications like that thinking I'm going to carry them on for decades. And certainly as an older GP, I would spend a lot of time deprescribing, which sounds a bit weird, but actually stopping medication is really rewarding, actually, as a doctor, because it's so easy, isn't it, to add on more and more medications. And most medications actually do have side effects. And a lot of them, we don't know the long-term effects, do we? Especially on cognition and our brain, but also on our bones and cardiovascular system.
Yeah, exactly. And I think, the point you raised about sleep is so key. People don't think of sleep as important, but as a neurologist, it is immensely important for the brain. And you're talking about it causing stress. And it's not just the kind of you get stressed out if you haven't slept, but we can look at people sleeping and then becoming sleep deprived and again measure their blood, measure their cerebral spinal fluid, and actually show there's more inflammatory markers. There's more byproducts that haven't been cleared because during sleep, those byproducts get cleared. So, it's stressing the system as in, pushing a plank too hard so it breaks, not just some sort of mental concept of stress. It's a physical stress to the system as well, not having sleep. And, on the medications, you're so right. I think, what do they call a Band-Aid medicine where, people keep getting cut and then you put a Band-Aid on. Whereas what we should be looking much more at is prevention. When I worked at CSIRO, which is our Commonwealth agency, we had a preventive health flagship and we demonstrated to the government that they spent less than 1% of the healthcare budget on prevention. And I do think that we have, for good reason, when we're still trying to work out what diseases were, very focused on fixing problems that we were finding. And what we've got to do is not develop those blocked arteries, not develop diabetes, try and prevent it from happening. I mean, the treatments are getting better all the time, but I think anyone who's living with diabetes would say they'd rather not have it. And we know the chronic diseases of aging, and WHO wrote a report showing 80% can be prevented.
I totally agree. And, prevention is key to so much. And I remember going to a lecture about 8 years ago now with Professor Walter Rocca, who's actually been on the podcast from the Mayo Clinic, talking about his work, looking at, I'm sure you're aware of it, women who are young, who have a bilateral oophorectomy, so they have their ovaries removed under the age of 40. And the increased instance of diseases that occur. And I remember thinking, yeah, I know about heart disease can increase. I know osteoporosis, dementia can increase. But then he's talking about even kidney disease, chronic kidney disease, which I hadn't realized at the time, but also all the different mental health conditions. So obviously I knew that clinical depression increases the longer we are without our hormones, but schizophrenia, psychosis, drug addiction as well, COPD, lung disease. And then thinking, gosh, this is massive, actually. And that's when I think you sometimes do need a light bulb moment, don't you, when you're reading things. And I suddenly then went back home and got my pathology notes out. And one essay I had to write, it was a 3-hour essay, and it had to write, is atheroma a marker for cancer? Now, for those of you who are not sure, atheroma is you get this sort of fatty deposit lining the blood vessels that accelerates, and then that increases risk of cardiovascular disease. So it's often the start of cardiovascular disease, so heart disease. And so I read this title. We had like 20 different titles we could choose, 1 3-hour essay. And I had this and I was like, oh, this is so exciting. But actually, it's connecting this inflammation. So the inflammation that occurs in the endothelium, the lining of the blood vessels, which increases atheroma, is actually very similar to this inflammation that occurs with cancers as well, for many cancers. And like I said before, when you think about our immune cells that fight infections, especially our monocytes and macrophages, they all can be really, really protective. They're like our army that protect us, not just from infections, but from disease. But if they've got the wrong microclimates, the wrong conditions, they will turn against us and they will become very inflammatory and produce all sorts of cytokines, chemicals that will worsen. And I remember thinking, actually, this is all related, because if you've got low hormones, estrogen, progesterone, testosterone, you've got the wrong nutrition. So you're eating the wrong chemicals, if you like, going into our bloodstream. You're not exercising. You're not sleeping yourself with stress. And then you add, your poor gut microbes. You can see how the poor body gets completely confused and starts being inflammatory. And then that's really hard sometimes to take back, because it's a slow process, isn't it? Getting back and reducing inflammation.
It is. And one of the things about inflammation in the body is it is a cascade. So once it gets started, it can actually build on itself and get out of control.
Yeah.
Every one of these chronic diseases of aging has inflammatory mediators.
Totally. And I also think, I spend lots of time with my patients explaining it is going to take a long time. There's not a quick fix, and you can't, do an exercise class and then expect to feel amazing the next day. Of course, you might a bit, but your body has to relearn. If you break a bone in your body, it takes several weeks to improve. If you have a bruise on your arm, it can take quite a long time to really improve properly. And I think internally, sometimes we're quite impatient with our bodies, aren't we? And we expect things to happen quicker. And then people can get disheartened and then think, well, what's the point of exercising? Or what's the point of stopping all these fizzy drinks that I'm drinking? Because it's not really having any short-term effect. But longer term, it really can make a huge difference, can't it?
Oh, absolutely. I mean, the research absolutely shows that. I think, again, this focus we've had on the Band-Aid approach, if you break your hip, you get a titanium new one, stronger than the one you had before. And if you block every vessel around your heart and manage to survive, they'll just do bypasses. And so we do have this kind of attitude of the quick fix. But again, anyone who has had bypass surgery, that is no small thing. And it's much better to what we're now able to do, even with some of our newer medication, is remodel those arteries. So actually reverse some of the damage that's been done. And I mean, some of the incredible research they've done in the brain, they've shown that exercise can actually increase hippocampal size.
Yeah, I mean, our brain is quite plastic in some ways, that it will respond. And even just looking at the blood supply through the brain, if we reduce inflammation in our endothelium, we can open up our blood vessels a bit more. Even that will make a difference. But actually, our brain really does respond to a different environment, which is something that we don't always think about, actually. And it's so crucially important. So we've got a lot to do. And a lot of it is, I feel a lot of my work is educating people so they can make decisions that are right for them. And we are all different. We all know that we could do certain things differently or better. And it's just picking what's going to be the best thing for you at this stage of your life to improve your future health and hopefully prevent as many diseases as possible. So I'm really interested to hear about your research over the next few years and how things change and improve. So I'm very grateful for your time today, sharing some of your incredible knowledge. But before we end, I'll always ask for 3 take-home tips, but I'm going to focus on the brain, actually, because obviously you being a neurologist. So 3 things that we as women should really focus on when we're thinking about keeping our brain as healthy as possible as we get older.
So I would say the 3 things to do. 1, the physical activity that I already said, and it is just by far, and I mean, we've looked at cholesterol and HDL and LDL and blood pressures, and you can imagine 1,000 different things we've looked at, and every time physical activity comes up way in front in terms of its impact on improving brain. The second is to talk about cholesterol. So there's a lot about cholesterol. However, in women, it's not cholesterol. So you know, there's the good cholesterol, which is HDL cholesterol, and the bad cholesterol, which is LDL cholesterol and cholesterol. But for women, it looks like in all the research for heart and for brain, and of course the two are interrelated, HDL is really important for women. So that's the good cholesterol and keeping it up. And in fact, because most of the studies were done in men for heart disease, and for men because they have large vessel disease, whereas women tend to get small vessel disease. So cholesterol and LDL has been really important for male health, and those medications have all been targeted at cholesterol and LDL. There's now development of medications to target HDL, but the vast majority of our older medications, they actually don't impact on your HDL. But green leafy vegetables and exercise can increase your HDL. So while we're waiting for the tablet designed for women, actually that's the way to improve your HDL. And then the third thing I would say, which women actually do really well, which is probably why we have a survival advantage, but is social connection. I think we do underestimate it. And in our increasingly complex and Zoom-related environments and the busyness where now everyone has to do everything, I think it's really important to remember, because, you know, it's not about how many friends you have, or certainly not how many Facebook friends you have, but women sometimes feel very alone. They're looking after a lot of people. They're in busy households, at busy workplaces, but I think that's really important for women too. So they'd be my top 3.
I love it. And all of those are achievable and something that we all should continue to work on. So I'm very grateful, and it's been really interesting talking to you. So thanks so much today.
Yeah, you too, Louise. It's been a pleasure.
You can find out more about Newson Health Group by visiting www.newsonhealth.co.uk. And you can download the free Balance app on the App Store or Google Play.